Yeah, I mean, what did you think about your brows, Joyce? Did it hurt? Brows?
No, with you?
Yeah.
No, not at all.
Okay, so tell them about your previous eyebrow experience and if it hurt.
My previous eyebrow, and I did get it in a nail salon before I was knowledgeable. And it hurt. It hurt so bad. Matter of fact, my girlfriend and I had planned to have a really fun night. We bought wine and movies, and that was the last thing we wanted to do when we limped home and went to bed.
Mm-hmm. So it's, you know...
But everyone's pain level is different.
Everyone's pain level is different, but honestly, I can say in all my years of doing this, I have a very few people that think it hurts. They'll say it was irritating, it was prickly, I didn't like it, but really nobody really says it was pain. So,
She's great.
Yeah. Oh, thank you.
Okay, you were.
I had my eyebrows done here a year ago, and I just had eyeliner done.
They're locked up in the pre-op office. The key's in my drawer.
Oh, yeah. Yeah, thank you.
I would have had to love it.
You're really good.
Did you bottom and top?
I did bottom and top, yeah.
Okay. Oh, I love
She did a brown with a couple drops of black, and when it comes back for my touch-up, the other one a little bit darker, but she likes to be conservative.
Now open both eyes for me.
But, I'm sorry, did you say
Okay, close.
Because she puts a topical on, and it really, I felt ticklish for a while, and she just, I never had any pain. Wow. She's very relaxed and really here.
So now, did you say your eyebrows have been done?
I had my eyebrows done a year ago, and then I had the touch-up done in December when we came back. Yeah, thank you.
So do you have to, like, how about the one of those when people have eyebrows? Do you have to shave their eyebrows off?
No.
No.
Leave all your hair there.
Yeah, that's what she says.
It's way more natural.
As it's older, as we're older, it's not a whole lot of hair.
That's true.
If I have to pluck them all when I was
No.
young. So
Yeah.
no, this is just
Okay.
what I have, and even the gray ones that come in, she said, just trim them.
Yeah.
You know, just so that you have more hair. So,
Yeah.
no, I've been very
Okay.
happy.
I didn't know if you had to do that. No.
Yeah, no.
Yeah, well, mine are, you know, plastic
These are really
more
Mm-hmm. It'll be really pretty.
They're very long.
It's not as vibrant when it heals. You know, it's a little softer look, but it's really pretty.
Your consult, your initial.
Just that thing about that you just stick to like black and brown.
No. I have this. I have a really pretty, like a plum, and then green.
Interesting.
Mm-hmm.
That's what we came here for the last year, and we bought on the spot for our eyebrows just because it was that discount. And truly happy.
Well, I bought it too. Because
That's nice. Yeah.
I knew I wanted it.
Doing okay?
I'm fine, thanks.
Well, and I'm gonna do the upper line.
Yeah.
I'm upper.
I got the upper done. I got that done. I'm gonna sit on that. Did you do it?
Chin down just a bit, honey.
I'm sorry
That's
about that.
okay. It's just natural to want to lift up.
I did it. I went to her. But I like you said, I like the way she does it because you can come back
You
and
can
get
go,
more.
you can go that way, you can't go the other way.
Black.
And,
Okay.
and she's
Love it.
And you're like me, you're light hair, light eyes,
Yeah.
light skin, so it's hard to know.
It is.
And I always get people asking, well, you know, should I do both? And I say, you know, do what you're used to because you don't know for sure. But the majority of people that do one or the other, they end up wanting both because it's just such a clean look. I can't describe it, but you see, I mean, you see with her, it's not a gaudy look to where you feel like you're all made up. So.
It's hard to imagine what I'll look like.
She did me at 10:30 this morning.
Well, I don't use, well, I
You were waiting for the head on.
Pardon me?
so it's hard to imagine what I'll look like with the line, without
You were one of the models.
You were the model. I don't have a line.
kind of shiny since it's new? Does it dull
So
more like?
that's what I'm saying.
Yeah, it will soften about 20 to 30% and look less liquid liner looking. It'll look more soft.
Because a lot of the pictures are like right after, so
Right.
I just wondered if it's softer.
Yeah, it definitely looks less.
There must be a lot of people in here, right?
There's a lot right now. You're on display.
Well, I hear it. So do you do like tint eyelashes?
No, I don't.
Okay.
But a lot of people ask about that.
That tells me all I need to know if you don't do it.
Yeah. Did you take the sedative? I can't remember.
Nope.
Yeah, so see, she did fine without the sedative. We just did the topical on her.
I just wanted it done.
Yeah, and she did great.
I didn't want to wait and think about it. And it
Now
was
I'm going to
fun.
have you open both eyes.
Yes. And when I
Darker than hers.
yeah, well,
but it
when I
looks
came
really nice.
when I came back, I had it a little bit darker and thicker. But that's how you want to start out because you don't know.
Still open?
Yep, just for a second, honey. We're almost
Do you have
done.
your eyebrows?
No,
Maybe grocery store.
I just have no.
not anymore. No, I have my head
Down.
pull my eyebrows.
Except I have
Close.
You have your hair to color, yeah.
More.
She had our eyebrows done last year. They look good too. Yeah. It's just.
I wish I did, but I don't.
Yeah.
Well, that's
Well, she just
drawn
draws it
on.
really shape.
We have a group out of our park.
Look at that, it's only a budget.
You never know.
I can't afford it, so there's no point watching it.
The desert. We
Oh no, I would in a heartbeat. I probably don't want to in the desert.
We're on the home stretch. Just a touch more on the uppers.
I'm doing good.
Good.
we want to see the reveal.
I know, right? It's like, come on! I'm gonna switch over here. Sorry, Dustin.
I'll switch places with you.
So how long is the whole process then for up and lower?
I would tell patients plan to be here about an hour and a half. If you decide you do want to take the oral sedative, I have you come 30 minutes before the appointment to take the pills. And then I have you make sure you have someone that's driving you because you don't want to be driving after I give you that sedative. I'm going to turn you this way just a touch
Would it be
more.
okay to walk home?
Let's say no.
Or walk in front of a car, yeah.
Yeah, that would help.
Chin down just a bit, Joyce. The reason is, you know, it's a narcotic, and we're liable. We don't want you
Right. That makes sense.
having something happen to you. And
Could I ask how long you've been doing this?
yes, I've been here 18 years. I've been doing the makeup for 15.
I think I could have easily been out
What's that?
I said I didn't know you were here.
Oh, wow. Yeah, I mean, we don't advertise this a lot. It's really, my patients are all word of mouth.
I don't live near the area, so that's why we never.
Oh, how'd you know to come today?
What did we get? We received a notice in the mail.
Oh, that's awesome. Good. I'm glad you came.
Yes, so much.
That's wonderful.
Where do you live? Trilogy. Oh, okay.
So you can see when I'm working also that I'm pulling the skin taut because everybody has that little bit of laxity. You know, anyone over the age of like 25 is going to have that laxity of the lid skin. So that's why I was saying earlier to somebody that, you know, you can go thicker, but it's not going to stay. It's as you go up on the lid, it gets loose, like lax skin. It's not going to look pretty. It's going to look like a blur, not going to be defined. And we're doing an eye line, so you want it really defined. And as you get older and the skin gets more saggy, which everybody will, because that's just the fortunate thing about gravity, or unfortunate, that like I've seen women come in to have eyelid surgery with Dr. Husto, And they might have had theirs, you know, 20 years ago, their liner, and they had them do the little tail. Well, now the tail starts turning this way.
Not a good look.
It's not
Sad
good.
face and
Yeah.
happy face in the corner.
I want to really see how the process works.
If you want to put the tail in, you could do that. Yeah, a little bit. They'll do little tiny part. It's like, it's not a cat eye, it's more like a little tiny eye.
I do a little bit.
It actually, because like that, a little bit of it actually opens your eyes if you have it a tiny bit. But you can do that with their eyeliner.
Of course, your point is good. You put that tail on with makeup. You can move it if you
Right.
need to.
Yeah, exactly. And I tell patients, this doesn't necessarily make it where you're never going to wear makeup, because I don't want anyone to have this done thinking it's the be-all, end-all. Most people don't. But if you're going out for the night and you're getting dressed up, you might add makeup to kind of dramatize your look. This is for every day, day in, day out, going to the pool, going to the mailbox, playing golf, whatever you do.
Racing down the river.
Yeah, you don't want to look like you're going out for the night at 10 o'clock in the morning at the pool. You'd look a little funny, you know what I mean?
Yeah.
So there are people that, you know, they will add their topical makeup, you know, to dramatize their eyes. I still wear eyeshadow and mascara, but I don't put eyeliner on.
Uh-huh.
Now I'm going to have you open the right eye. Beautiful.
Oh, good.
Oh my gosh, I'm so glad we did the blue.
So we're glad we did it, huh?
Yay! Okay, close.
And
Now I'm
it was
gonna
last minute.
It was. We were going to do brown.
Ah.
And we were she was on the fence, and I said, no, we're doing blue.
Do you have purple?
I do have a dark plum. It's really pretty. It's not an obvious purple. It's like you have to really look
More
at it.
of a brownie
to see it.
purple? Blackish purple?
Blackish purple.
Okay.
Okay,
Is that just saline?
This is an eye wash, yes. Now I'm going to go back over here, and we're on the home stretch, last part here, okay?
Okay.
If you do one, then together it's
I'm going to turn you back this way.
That's what I'm saying.
You know what, I'm not sure. On here, cashier, I don't know where, when it says what the discount.
Last little bit, and then I'll be sitting her up.
Let's see, the book might be on the other side. So makeup there. Okay. I got to see that. Yeah. Upper and lower.
Now open both eyes for me. Uh-huh.
We're getting 320 if you just
Look down.
all together. You really
How successful are lips?
You know, I don't really do many lips, and the reason I'll tell you why. It's very short term. You can't go outside the vermilion border, which is where the lip tissue and the skin come together, because if you do, it looks like you drank Kool-Aid. I just have never found that lip color, for what you pay and go through, is worth the time, effort, and energy, because it doesn't stay.
Okay.
So I just tell people, save your $700 and buy some stay-on lipstick, you know, versus going through that. And plus, as we get older and our lips get more wrinkly, it's you're not going to see much of it. You know what I mean?
Well, lips kind of shrink too.
They do. So you can kind of see here, that's the old tattoo. That old, see that little
dot?
That little blurb up here? That's the old makeup she had years ago. I'm not going over that.
Okay.
Okay? I'm
Because
not.
that's the part you said you wouldn't have done in
Right.
the first place.
I'm just going in the lash line a little thicker on the outer corner, but this little area here, which we talked about this at
Yeah,
the
that
consult,
little
she knows
tail.
that's going to just fade over time. And it won't be, nobody would notice that, but I'm just right here with this light, so I wanted to show you guys. But I don't go over that and, you know, make that more prominent. And the eyelid skin is the thinnest skin on our body, so you really can only do so much in one session. If you keep tattooing and tattooing and tattooing, you're just going to cause the patient a lot of discomfort, a lot of swelling, and no gain. So that's why we break it up into the 2 sessions.
Is it like a week apart or?
8 weeks.
8 weeks.
Does this stuff sting the eye at all when it gets in the eye?
Have you had any stinging, honey?
None.
No. sometimes the numbing will sting a bit, but it doesn't harm the eye. It's pH balanced for this procedure,
Oh, okay.
so it's safe.
So it's more like putting in the same gel.
Kind of. I mean, it does have a sting to it at times for different people, but it's not going to harm the cornea or anything like that.
You have to wash out the excess so you can see what you've done.
Right, and it just cuts down on the wiping, because the wiping is very, very aggravating to the skin. If you wipe that skin with the gauze over and over, that will cause swelling and irritation. So the eye wash just helps to cut that down to a minimum.
Is there a cream or anything you have to put on that after?
I send the patient home with a little Aquaphor ointment, and you'll put that on twice a day for the first 2 days. The thing about the liner area, when you're putting that on, you want to put a very small amount because it will blur your vision if you get it in your eyes. Almost done. I'm going to have you open both eyes again for me. Look down. Look at me again.
You really have it right in there.
Look down.
9 months. Do something for yourself.
So how long is the first appointment?
For consult or for treatment? The treatment is depending what we're doing. I tell people plan about an hour and a half. Get a little more pigment here. If we're doing the consult, I tell patients plan an hour. It's usually not that long, but.
I found you want to do it double. It's like instead of do the knot of the knot, almost like that circle knot, you do one more. And
We're almost done.
Okay.
I know I've said that 30 times, but I'm a perfectionist, so
So now are you
And I
putting
trust
ointment
you.
on at
this
point?
is numbing. I'm still putting numbing.
Oh, because you're not finished.
Yeah. So over here you can see she has that old little remnant of a tail over here too.
Right.
You see that little,
Yeah.
so that we won't be going over, but you can see that old.
Did you do her lower also?
Yep.
I saw in some of the pictures, the lower you only tend to go like halfway. Can you go all the way across?
Yeah, I would say probably 80% of people we go all the way, but there are some that only want it half or 3/4.
Okay.
Yeah.
Oh, okay.
If that's how they wear it, you know.
Yeah. I know, me too. I think for some reason.
Because I just softened it. I made it darker here and then softened it.
Yeah.
This way.
So she's had the upper almost done tonight.
We're almost done.
I'm just going to say you don't do that.
Her sister did.
Yeah.
She did upper and lower at the same time.
Yeah, most people do upper lower same time. There's only a handful that do one or the other.
Oh, because you have to come back for the enhance.
Chin down a little bit, honey. Thank you.
It's on your back. You have a different one.
So what is the most popular color?
Black.
Oh,
Yep. And even, you know, I had the question earlier that can people with light eyes use black? Absolutely. The thing about lighter eyes is you actually want dark because it really makes your eyes pop. If you do a light color, it's just light. Everything's light and it's just like, oh, you want something to make your eyes pop. The key is to do thin. If you have light eyes, you wouldn't want to do thick black around both, you know, top and bottom.
Because you don't want to be a raccoon.
Exactly. Yes. Yes.
Can you vary the thickness across the eyelid?
You can. The thing about the thickness is I tell everybody I'm not going to start thick. I don't care if you come in and you wear it, you know, an inch thick. I'm not going to tattoo it like that. We're going to kind of see how you do. And then add. But even there are patients, it's rare, but I have patients sometimes that come in for the consult, and I tell you to wear your makeup in. And if they come in and they wear a lot of makeup, I'm very honest, and I'll say, you know, I'm not doing it like that, or I don't think that's a good look, or whatever. I'll tell you so that you know. And if you choose not to do it, we don't have to, you know. But I want you happy, but I also want you to understand the ramifications of that 20 years down the road, you know. Plus, there's a higher risk of the pigment migrating when you go up in the lid and you're up on that higher skin. It's not as taut as right at that lash base. You know, you get this, everybody gets this laxity. You see when I do that? And she doesn't look like she has a lot, but you can see when I pull, you have that little laxity of skin. So if I tattoo way up there, what's going to happen? That skin's loose. It's going to just look all blurry and all blurpy. Yeah, you know what I mean?
Really
so
messy line.
it's not, I mean, when I'm tattooing, even on that taunt part, I'm pulling it tight to get it straight. But the minute you let it go, it's going to look like this. And it's just going to look really cruddy and kind of cloudy almost. So you really want to, you know, and I think a lot of patients, unfortunately, they don't know these little things because, you know, you don't hear that stuff. But I want my people educated. That's why I always do consults, because people think they might, what they heard at this person's house or at the nail place or their hairdresser told them this or that. It might be false information or not accurate. And I want you to know what you're signing up for, what's involved. Because an educated patient is much happier because they know what they're having, you know. So.
I keep trying to check out yours.
Oh.
Stephanie, if we had a consult with you like a couple years ago, do we need to schedule another one?
Are we doing a different area?
No.
Okay. No, I don't think so. I mean, if we talked about it, then I think you're okay.
And probably maybe the prices are different.
The prices I know have gone up over the years. Yes, it's probably not a huge change, but I think in everyone's bags, I think they gave you the little pricing.
Okay.
And then today, if you prepay, it's 20% off of the price. So
Discounted price?
The second line, the second row.
Right. Discounted
column.
Really? She told me in order to get that price, I had to pay it today.
You do.
I don't think she gave me 20% off.
Yeah, no, if you pay today, you get the 20%.
They take it right off the sheet.
Yeah.
So if we pay today, can we schedule how far ahead?
Just have them look at my schedule because I'm not sure when I'm booking for, but they'll schedule an appointment for you.
I've already got mine
scheduled. Yeah.
And for eyebrow, what's the, is there any recovery time or?
Yeah, I mean, you're going to have, they're going to look dark initially. You definitely want to stop any aspirin products a couple of weeks prior, fish oil, Excedrin, anything like that, because that's going to help minimize bruising and swelling. And then afterward, they do always feel darker, more red for a couple of days. And then you'll put ointment on.
Try to figure out if I can get it done before my trip or after my trip. So.
Yeah, so just have the girls check.
So a few days.
We're all done, honey. I'm just going to clean around you, okay?
You did great.
Yeah, if you had a
Thank
week,
you.
then you know you were safe.
Okay.
So now I'm just going to clean around the skin because my gloves make a mess and kind of stain her little cheeks. And then I'll sit her up.
What about blood thinners? Are those a problem?
They're not a problem, but you will get more bruising and swelling. So if it's something you can go off of temporarily, I recommend that. If it's something you can't go off of, then you just kind of need to know you may find that you get a little bruising.
Now, when I had my eyebrows done by a different person, she said you need to touch up about once a year. Is that correct here?
I don't touch up that often.
No.
Yeah, I mean,
Just a little on her nose.
yeah, I don't want to say anything about that, but some people will undercorrect you to have you coming back every year. Some patients, their skin definitely. I have some women, they're in the sun, they smoke, The nicotine will rob the color. Sun exposure, certain medications. I have a couple of women that are they have metastatic breast cancer, and they have chemo that they take a pill for every month. They're going to be coming in more frequent because anything going on systemically in your body will affect your skin and the retention and how quickly it fades. So there are exceptions to that, but for the most part, my patients, once we've done the 2 sessions, I would say 90% of people, they're getting at least 2 years, sometimes, 3, 4. It also depends on the color. So if somebody's doing a really super light eyebrow color, that's going to fade more than someone who's got a darker color. So there's a lot of kind of variation. So I don't say that across the board. I just say, we're going to call you in 2 years. If you're ready at that time, you come in. If you're not, then say, hey, I'm doing awesome. And then they'll reset your recall for 2 more years. Because it's super variable. There's really not an answer, I made a big mess here.
You're allowed, you're an artist.
All right. I'm going to have you open your eyes, honey. Good. And I'm going to clean just a little more when I sit you up.
Okay.
I see a little watering.
The light is bright.
Oh, the light!
Thank you. Thank you.
Now they will feel a little beat up for about an hour. As you remember, her sister there, we did hers this morning.
You didn't do any sedation, Joanne? You didn't do any sedation?
She did.
But I don't think I really would have needed it.
Okay.
I mean,
Wow.
So your eyebrows done?
Right?
I love mine. Sorry. Yeah. Thank you.
Go ahead and get a shot of her.
Yes.
Oh, yes.
It's called Persian
Smile.
version. So,
It actually, on your gloves, it looked so bright. On
Yeah.
your eyes,
Yeah.
it looks a lot more mellow.
yeah.
with
So
the blue eyes, it
underneath,
looks
I'm
really
gonna
good.
clean underneath. That's just from my gloves. But isn't that
Smudge look
crazy?
someone else wanted.
I know, right?
I like the smudge. Will that color fade?
It will fade, so she will definitely touch up. It doesn't fade a huge amount, but it just looks softer.
Looks nice.
So
Oh, I
I
do
tell
like it.
people plan it out.
I'm like, you get to see it, right?
I know it.
I'll
Yeah.
get you a mirror.
Okay.
Um,
main stage stuff?
yes, we can.
She's making it.
Yeah.